Hi, welcome to Hey Doc with me, Dr. Kady. This is Symptom Checker. Remember, smash the like button and do remember to subscribe. In today's episode of Symptom Checker, we will be looking at the life-changing condition called dementia. Dementia is an umbrella term for the loss of memory and other thinking abilities, which can be considered as severe enough to interfere with daily living activities. There are three causes of dementia. The first is Alzheimer's, accounting for almost 60% of all cases. Alzheimer's disease is a degenerative cerebral disease characterized by a slow decline in cognition and the ability to function. The second most common cause of dementia is vascular dementia. Then the third most common cause is Lewy body dementia, and each are responsible for 20% of cases respectively. Vascular dementia usually arises from multiple infarcts or general small vessel disease. This type has a more sudden onset than Alzheimer's disease. Dementia of Lewy body is slowly progressive, and it shares many of the features of Alzheimer's disease and Parkinson's disease. Before we move on to talking about the symptoms of dementia, let's consider some of the risk factors that could lead to an individual being more susceptible to developing dementia. The risk factors are divided into two different categories. The first being the non-modifiable risk factors, and the second are the modifiable risk factors. Let's look at the non-modifiable risk factors first. We have advancing age, which is the most important risk factor in developing dementia. The second non-modifiable risk factor is learning disabilities. In people with Down syndrome, dementia develops 30 to 40 years earlier than the average person. Finally, we have gender. The rate of dementia is higher in women than it is in men, especially with Alzheimer's disease. And finally, for the non-modifiable risk factors, they are genetic factors. The second group of risk factors are the modifiable risk factors. And this simply means things that can be changed, altered by an individual. With modifiable risk factors, we have alcohol consumption, smoking, particularly for Alzheimer's disease, obesity, high blood pressure, high cholesterol, head injury, and finally, education and mental stimulation. In dementia, there is a widespread loss of mental function. This refers to a loss of a variety of abilities. That being said, let's talk more specifically about some of the symptoms that can be observed in patients with dementia. The first is a decline in memory. There is mostly an impairment of learning new materials or retaining new information. What is also seen with the decline in memory are repetitive questioning from the person affected and difficulty recalling time and dates. Then we have failure of other areas of higher cognitive function, which will ultimately affect normal daytime activities and other executive functions. The higher cognitive functions that are generally affected include difficulty in performing complex tasks such as tying shoelaces, doing up a tie, or washing dishes, all of which the individual would have been able to perform prior to being affected by the disease. Then there is difficulties in judgment and planning, as well as analytic thoughts, problems in finding one's way around familiar places, impairment in language, and this includes problems with expressing themselves or getting lost in conversations. The third area that is grossly affected in patients with dementia is behavior. What tends to happen is that the individual starts to display challenging behaviors. Behavioral and psychological symptoms of dementia include depression, apathy, agitation, disinhibition, psychosis, which can include delusions or hallucinations, wandering behavior, aggression, incontinence of urine, and/or of stool. Challenging behavior is frequently associated with high level of strain and distress for the family and the carers, and has often been the reason for admission to institutional care. Finally, what can be observed in patients with dementia is that they lack the ability of basic self-care. That's all that I have for you in this episode of Symptom Checker. I truly hope it's been helpful, and I look forward, as always, to seeing you in our next video. In the meantime, though, we have plenty of other videos for you to check out right here on Haydoc. And do remember to smash the like button and to subscribe. Do remember also to get the conversation going in the comment section. And as always, I will see you later.